Hello and welcome to tonight's conversation. So today we are discussing signs of mental health disorders in sexual practices. And tonight I'm joined by Dr. Dalal, and I will be introducing him very shortly. As you can see, we've started a few minutes late, but we'll be fine. So, without wasting time, let's have Dr. Dalal into the studio. Dr. Dalal, good to see you, my brother.
How are you, Dr. Mujajati? Thank you.
I'm well. So, talk to me. How was your weekend?
Weekend has been good so far. It's been productive. Spent time with family, and it's been hot though. So drinking a lot of water.
No, I'm glad to hear that you're drinking water, Doc. Very important.
Yeah.
Yeah. So, Dr. Dalal, I know that we have quite a number of people that are yet to join this conversation. So we'll give it a few seconds or even just a minute to let people join us. And in the meantime, for people who have just tuned in or who are just following us, please let us know if the sound is good, and also go ahead and tell us where you're watching us from before we get started. If you're at home, well, I think this is a topic where you might want to make sure that your children are sleeping. Dr. Dalao, do you think this is a topic for children? I doubt it is it?
No, although I will try to keep it PG-13, but I think depending on how the reception is, it is PG-18.
Yes, anyway, we are doctors, but again, at the same time, like you've rightly said, there could be children who are listening. So we'll keep it PG-13 as much as we can. But again, it's a PG-18 conversation, if not older. So yeah. So I'm happy that you took time, Doctor, for us to discuss this very difficult topic. It's not a very easy conversation to have, especially in a society that is so culturally conservative like ours.
Yes, Dr. Mujahati, I agree. It's a very sensitive topic. And even when I do have these conversations in my practice, it's not something that just comes out. No one really does come out to say, I've come with so and so problem to do with sexual disorders. It is often something that you have to bring out or you have to probe. But it is something that we need to be discussing because it is of concern and it is something that people do come with in practice.
So, Dr. Delau, I think that we have the critical mass for us to be able to start this conversation. So, to set the ball rolling, Doc, who is Dr. Delau? So, do tell us, your background. Um,
Okay. Yeah, so Dr. Dalal is a psychiatrist. What that means is Dr. Dalal is specialized in mental health, and the organ that is we're talking about here is the brain and how it functions. And I am born and bred here in Zambia, and I am currently practicing at the university teaching hospitals as well as at a few peripheral hospitals right here in Lusaka, Zambia. Dr. Dalal has also been privileged in advocating and being an advocate in mental health and grassroots outreaches right here in Zambia. And I've also had the opportunity for the past few years to strengthen mental health systems within the country here. So, in a nutshell, Dr. Dalal is a medical doctor who specialized in psychiatry, mental health, and is working in this field.
Dr. Delau, are you married? I've seen one of the ladies just asked me to ask you.
No, I am not married.
Are you available, Dr. Delau?
That's an offline question.
All right, now that we have that out of the way, let's get started. So, Dr. Delau, we are discussing signs of mental health problems or mental health disorders in sexual practices. So, here what we are discussing to the uninitiated, we are talking about mental health problems. But of course, we are discussing mental health disorders that arise from various sexual practices that we have as human beings. So, like Dr. Dalao mentioned earlier, that this is a very sensitive topic, and we will do our very best to be as candid as possible, and also at the same time to be as sensitive as we can, where we can be sensitive, but we will be as candid as we can be, so that some of these problems we can or not discuss them openly. Now, before we to set the stage, Dr. Delao, can we get certain terms or certain language issues sorted out? When you talk about sex and libido, what are you talking about?
So, Dr. Mujajati, when you ask, say, let's just say we're asking 100 Zambians to define what sex means to them, we will have different answers because for everyone, everyone has a different understanding of sex counts and what sex really means. For some people, it means having intercourse, where the male and female meet together. So there's a penis going into the vagina. So that's basically sex. While other people see sex as alternative means, and again, speaking of being candid, it could be oral or it could be manual sex as well. So this is what we're talking about sex when we're basically defining sex. But having similar definitions of sex, or at least sharing definitions that are aligning everybody, is something that is not out there. You won't find a textbook definition of sex out there because sex means different to different people. But then when we're talking about a sex problem, then we're basically talking about in the health field, we talk about it from a perspective of sexual dysfunction. And this is where we say it can happen to anyone. And it is basically involving a disability or a disruption in your desire or in your ability to perform the act of sex. So one thing that we will discuss as we go on with this conversation is we're going to talk about the sexual response cycle, which looks at what you just asked, libido. And libido is basically saying your urge and your sexual desire to, take part in this act of sex. So to answer your question, we usually look at sexual dysfunction as a problem that prevents a person or a couple from experiencing satisfaction from sexual activities. And as we're defining, I would just like to throw a statistic right now to say over 40% of women and over 30% of men report some degree of sexual dysfunction. So this is a global statistic.
So now, just to set us off, when you say sexual dysfunction, what are some of the examples of sexual dysfunctions that you see commonly in your practice here in Zambia?
Okay, so I will just try to put a further layer to this and just try to break it down for our listeners. So sexual dysfunction basically falls into 4 categories. And these 4 categories include desire disorders. And desire disorders is basically where there is a lack of sexual desire or interest in sex. Or the other way around is where there is an excess of desire in taking part in sexual activities. So it could be a high or a low desire. Then the second category is arousal disorders, where this is where there's an inability to become physically aroused or excited during sexual activity. Then the third one, Dr. Mujajati, is where we talk about orgasm disorders. Now, what do I mean by orgasm? This is basically you getting that euphoria, that excitement as you're taking part in sex. So other people have an orgasm disorder where they have delay or absence of orgasm, and this is also known as the climax. And then the fourth category, Dr. Mujajati, is where we talk about pain disorders. And this is where there's pain during intercourse. When taking part in the sexual activity, either the male or the female face some kind of pain during that activity. Now, here in Zambia, in practice, again, as I highlighted earlier on, I haven't had someone directly come through to say I have a sexual problem or have a sexual disorder problem, but they often come with other concerns such as mood, anxiety, or any other thing. And then, you find out you're just helping them, assessing them. And then you find out that, oh, there's actually a concern with sex because we are trained to ask about it. And the common things that people usually come through with are pain disorders, in particular women. They come in with what we call vaginismus. So this is where there's pain before or during intercourse. Then there's also a very common concern amongst youth, and that is to do with, chronic masturbation or excessive masturbation. Again, this is not categorized as a sexual disorder, but it is something that is of alarm and concern to many people in my practice that come through. Then the other thing that I also often see in practice is also the concern of sexual incompatibility. So what do I mean? Big term there, incompatibility. So this is where in a couple, either the male or the female will not feel, that they are actually compatible with one another, that they are being aroused by one another, or they're being supported during sex with one another. So that is what we call sexual incompatibility. Again, this is not a disorder, but this is a problem or a symptom that people present with. Then there's also, Dr. Mujajati, and this is something that is of concern, is what we call hypersexuality. This is where individuals have an increased need or desire to have sex, and so they come with a hypersexuality disorder. And finally, this again is a concern, and it is not a disorder per se, but it is something, as you highlighted, due to our culture, our religious backgrounds here in the country, it's not something that is openly discussed, but that of excessive use and viewing of pornography. So when we talk about practice here in Zambia, these are things that I have had the opportunity to actually help people through with.
Right. So now, doctor, I know that throughout this conversation tonight, we will pick out some of these specific sexual disorders that you've talked about, or some of these concerns you've raised. We'll go into them into greater detail. But I need you to clarify something, and this is the crux of the matter of this particular conversation. From your perspective, why is sex and libido important to health well-being, as in the well-being of the person? Where does sex and libido come in? Is it important for health or for well-being of the person?
To answer, yes, Dr. Mujajati, libido or sexual arousal is extremely important for well-being and for procreation, because this falls under our reproductive health. And also puberty and prepubescent and post that and adulthood actually requires that, we should have a good libido, so to speak. So this falls under what we call the psychoanalytic. Again, this is where we are talking about the mind. And it is the psychic drive or energy which is associated with sexual instinct and is present in many other desires as well. And again, libido is influenced by many things in our reality, from our biology, which is our physical well-being, to our learned behaviors, to many social factors. And it actually helps us also thrive in our day-to-day lives. So libido is actually one of the key pillars of well-being in an adult as well. So to answer your question, is libido important in our well-being and for our health? Yes, it is, including the act of sex. Is it important? Yes, it is.
Right. So now, Doc, you are saying that sex is important. Of course, you've defined it. You're also saying libido is important for, for well-being. And of course, you've defined libido. But again, you see, the issue here is that when do these things become a disorder?
Okay,
at what point do you say, of course, sex is important, libido is important, like you said. At what point does it become a disorder?
Okay, so Dr. Mujajati, in psychiatry and mental health, we usually talk about disorders from a perspective of functionality and productivity. And when I say productivity, I'm not talking about just reproductive health, but I'm just talking about an individual's ability to be useful in their day-to-day lives. So because of the desire that you have to procreate or actually have sex, if that is affecting your ability to go about your day-to-day life and function, for instance, for a young person to go to school, to get an education, or go to work and get a job, hold a job down, in a relationship, look after children, if your desire of sex overrides all these day-to-day functionality for you to be thriving, then this is where we end up start saying that, okay, this is actually a disorder. Because when we talk about sexual desires, these are often an important factor in the formation and the maintenance of intimate relationships in human beings. And then when there is a lack of loss, or when there is a loss of sexual desires, this can actually adversely affect relationships as well. And as human beings, we are a social being. We thrive with others. Even individuals that keep to themselves, they have a circle around them that they usually interact with. And sex actually plays a very key role in that as well. So when there's a change in sexual desires of any partner in a sexual relationship, and if that is sustained and it's unresolved, it may cause problems in the relationship. And this actually leads to other problems that has a ripple effect in an individual's life. So to answer your question, when does it become a disorder? When the desire of your libido actually causes an impact in your day-to-day functioning.
Right. Now, Doc, I'll take you back a bit. I know that earlier on you had gone into trying to talk about the concerns or disorders. One of the concerns or disorders you talked about was vaginismus. Now, I know in your categorization of sexual disorders, you talked about pain disorders. Let's get into a bit more detail on vaginismus. What is vaginismus, doctor?
So, Dr. Mujadati, vaginismus is specific to women, individuals that have the female anatomy. So it's a condition where the vaginal muscles contract involuntarily. And this usually happens when um, during vaginal penetration of any form. It could not just be the penis, but anything else that you try to put in the vagina. It actually just contracts because the vaginal wall is made of muscle that is very sensitive as well. And depending on the woman or the young girl, the effects of vaginismus can vary from mild discomfort to severe pain. And as we usually say in when we're educating patients, it's usually talked about in reproductive health. So this is something that usually gynecologists support individuals with. And the thing is, individuals living with vaginismus can actually turn routine things like inserting a tampon or just having sexual intercourse into a frustrating and very uncomfortable ordeal. And further on, vaginismus is actually further categorized into primary and secondary. Primary is basically where they were born with this condition. So from childhood, they have that challenge where, the muscles of the vaginal wall just contract. But then secondary vaginismus describes when, vaginal penetration prior was okay, but then later on, it has had an impact and, they're contracting now. And secondary vaginismus may be due to many causes. And for this reason, it's very important to understand that vaginismus is specifically to women, and it's painful intercourse in a woman because of the involuntary contraction of the vaginal walls.
So this is where the vagina becomes extremely tight. That's what you're saying.
Yes, but it's not just tight; it's actually pain because when that person tries to have intercourse, then it's very painful, and the tightness just doesn't allow the pain. It just triggers the pain receptors, and from sensation, it's actually more towards pain. Some women
Right.
actually describe it as being pushed against the wall, pressure against the wall, because there's just so much pain.
Right. Now, so then how do you diagnose vaginismus?
Okay, so Dr. Mujajati, we usually use the assessment, which is where we do the history. The first step in diagnosis is discussing the symptoms that women come in, including the sexual history. We want to find out whether it's primary, whether it's there from birth, or whether it's secondary, where there's a cause prior to that. Sometimes this happens in menopausal women where the hormonal changes are taking place, but sometimes this also happens in young women. And in our country, and I would like to state this because I've seen at least two or more cases in this scenario where it's been because they have had prior trauma. And this trauma that I speak of is not just physical, but also psychological, where these young girls have either been molested um, uh, at a young age, or even as adults they've been raped, or even in marriages, Dr. Mojajati, where they're having non-consensual sex. And again, this is the culture that we speak of, because we are living in a culture where, you know, once you're married, then there's no such thing as consent in a marriage when you're having sexual intercourse. So again, we have had some situations where a woman has developed secondary vaginismus because she has been, you know, through such psychological trauma. And these causes actually allow us to figure out what is leading to that. But many times the causes are not known, and the diagnosis is often done by the gynecologist and then further referred to a psychiatrist like myself to support them through treatment. So again, we also do a physical evaluation where we actually carry out a pelvic examination. And because this is a very painful ordeal for the woman, it's often done in a sensitive nature where, you know, we look for signs of potential infection or other issues that may be causing the symptoms, because also infections can also lead to vaginismus at times. And also many women with vaginismus are actually unable to tolerate also inserting a tampon. So that is another thing that we usually look for and ask the woman to say, how has your you know, reproductive health history been? Are you able to use tampons? Is that something that affects you? Or we also ask probing questions like, how about penetrative sex? Is that something that concerns or alarms you? So these are things that we usually use, and this is how we actually diagnose. So basically, it's diagnosed through assessment, which involves asking questions and also carrying out a physical examination.
Now, doctor, these things that some young ladies, you know, or ladies put in the vagina to induce tightening of the vagina. Do you suspect that some of these products that they put for vaginal tightening can also potentiate vaginismus?
So if those products that are being used, if they're not, you know, certified, or if they're not safe, then they can lead to infections. And Dr. Mujajati, infections can lead to vaginismus as well, because there are many times that young women put certain things in their private parts in the vagina, and that ends up leading to an infection, a pelvic inflammatory disease that can also complicate into vaginismus later on, because the part of the vagina is very sensitive and becomes inflamed. Also, Dr. Mujajati, there's also the understanding that it can, not just that it can predispose to vaginismus, but also the tightening, what products are being used in particular, because some of these products, they themselves have side effects. They themselves can lead to over-contracture of the smooth muscles of the vaginal lining. And as we're talking about tightening, it can actually lead to an over-tightening of that part of the body. And again, that can lead to closure. So it may not specifically be vaginismus, but this may be something in the line of painful sexual disorder, but not vaginismus per se.
Right. So, doctor, how then do you treat people who present with vaginismus? How are they treated? How are they assisted?
So, Dr. Mujahidi, I would like to be frank and candid with you again, because you see, again, we are even born and brought up in this same culture. It's something that is not openly discussed, even in the healthcare industry. You know, this is a condition that falls under reproductive health and amongst gynecologists who are reproductive specialists. And treatment is there. That is the good news. It is very treatable, and it is helpful for women, the young person or the woman, to actually work with a counselor who specializes in treating sexual pain, as well as a gynecologist who is familiar with vaginismus. Unfortunately, this is a concern where, you know, we don't have that many healthcare workers who are also very understanding or comfortable with treating vaginismus. The treatment involves what we call therapy, which is what we call sex therapy, as well as physiotherapy for the vaginal pelvic muscles. So this is what we call Kegel exercises as well. And this takes place from a duration from a few weeks to a few months, where the woman is taken through these counseling sessions, which are specifically called as sex therapy sessions. And then they can also help them with the Kegel muscle contracture. Also, they are taken through the pelvic vaginal wall dilatation, which is actually undertaken with certain instruments or tools that are supported with the woman, that they use through that process. So treatment involves therapy as well as exercise. But then there's also medication that can be supported if there's a lot of pain during the process. So pain relief is also offered in that treatment. So truth be told, Dr. Mujajati, vaginismus is totally treatable. Now the question is it curable? Is it something that can completely be taken away? It depends what the cause was, the underlying cause. If we can find the underlying cause, if it's primary, then it's more often difficult. But if it's secondary, then usually it is reversible. Yes.
Right. Now, doctor, let's move on to another concern or disorder that you raised. You spoke of issues of sexual incompatibility. First of all, begin by defining what you mean when you say two people are not sexually compatible. What does that mean?
So, Dr. Mujajati, according to our diagnostic criteria, sexual incompatibility is something that is not well defined. And again, I say this because there's many cultures, there's many beliefs, and there's many other factors that come in from the social and environmental factors. So there's no official definition of what sexual compatibility or what sexual incompatibility means. But this is simply something that, to an extent, we just simply say that a couple perceives that their shared sexual beliefs or their preferences with respect to intercourse and sex, or their desires with respect to sex and needs with their partner are not, met with one another. For instance, one partner wants something, the other partner wants something else. So it's really about the similarities that or lack thereof that exist between the partners. So we also talk about it from a layman's perspective of what turns one person on and what turns off another person. And this is not just physically, Dr. Mujajati. We also talk about it from a perspective of emotionally being connected or being supported by one another. We also talk about it from the cognition, thought processes. Are you connected at that level as well as behaviors that you carry out pre and during and after sex as well. So basically, sexual compatibility comes down to how well your individual beliefs, needs, and desires around sexual activities actually mesh and meet together. And this also, Dr. Mujajati, includes your definition of how frequent you should be having sex and the duration of the sex, and also the environment where you're having the sex. So there's a lot that goes into defining what sexual incompatibility or what sexual compatibility means. But the answer to this is the less the similarities in your sexual preferences, desires, environment are, the higher the incompatibility that you are experiencing in as a couple or as partners.
So are you saying, doctor, that if one partner likes oral sex and the other one doesn't, that would qualify as incompatibility?
Yes. So as simple as that, Dr. Mujajati. Another simple example would be if one partner wants to have early morning sex whilst the other partner wants to have late night sex, that also is considered to be something that is incompatible, in the sense that these two individuals have different preferences about their desires and timings as well. But again, Dr. Mujajati, I would like to guide here to say that if we're talking about relationships, for instance, married couples, incompatibility is not something to be alarmed by, because in a marriage there are a lot of factors that you differ on, from raising children to religious preferences to traditional preferences to financial, to a lot of different things. So all of these things wouldn't mean that you are not compatible per se, but it's just something that you differ on, and this is something that you may need to work on with time.
All right. So what you're saying is that you could have these differences, but if the difference is casual, it would not amount to incompatibility. But you're saying that the difference has to be big enough between the two, that it's very important between the two, that it becomes an issue. Therefore, it then leads to what you call sexual incompatibility. Is that what you're saying, doctor?
Yes, I am, Dr. Mujajati. And to further add to what you just said, in the analysis, when we do the psychoanalysis, which basically means to understand where you are coming from as individual partners, we look at it from the perspective of problems. And what I mean by that is, are these problems that are immediate, or are they problems that are something that are going to be lasting for a long time? and we put them into two categories of perpetual problems versus unsolvable problems. So perpetual problems basically means that every time the problem comes up, the couple cannot solve it right there and then. And this means that there will always be that time that the issue comes up because the two partners are different people and it has to get renegotiated each time. So this is what we call a perpetual problem, which is very common amongst two people. No matter who you are going to have perpetual problems that constantly need renegotiations. And as you're negotiating this, Dr. Mujajati, you will come to a certain compromise or a solution, right? But then there are certain times in we talk about unsolvable problems. This is where no matter what you do, um, there's just no coming to a negotiation or compromise, and this is what we call unsolvable problems. So to answer your question, what you've said, to add to what you've just said, very true. Incompatibility doesn't necessarily mean that these two people are not okay with one another, but it simply means that in that particular time they don't agree, and but however, this is something that they can compromise and move past.
So, here in Zambia, and also looking at your practice, how common is this problem of sexual incompatibility?
This is something that is highly frequent in terms of incompatibility. There's always something that does come up, especially in relationships, in married couples, that is, just brings about a bit of friction and challenge. Sexual life is something that is a concern that does come up in Zambian couples, especially young couples, as well as midlife. When I say midlife, I mean this is where the woman is either going through menopause and the husband is equally, aging. So these concerns often do come through. And this is something that usually comes up in relationships where either one partner has come through with a concern such as anxiety, such as depression, or maybe mania, which is a high energy. And the partner just brings out to say, look, I have this problem. And when you probe them further and ask them about their sexual life or sexual history, then they will start guiding you to say, yes, I do feel like this, and I do feel I am incompatible in that sense. They won't say incompatible, but they will say that my partner doesn't understand where I am coming from or what I want. And with respect to sexual incompatibility, Dr. Mujajati, I feel I need to guide you, the viewers, on this one. And the reason why I say this is it's because it's very important to understand this. It's found that for women, the sexual incompatibility is often due to the lack of emotional attachment in that relationship. So it's not even more about the physical act of sex itself, but that emotional and cognitive connection. On the other hand, for men, it is more to do with that desire and the physical attachment. So there's that mismatch already in both the male and the female individuals that comes in. But this actually brings about something to think about, to talk about, and to be aware of in our country here.
So then how do you treat this condition? Like, how do you assist people who come with this problem of sexual incompatibility? How do you assist them?
The answer here, Dr. Mujajati, is communication. And this is something that, again, we don't do as a people in Zambia, in the culture, in the belief, because you see, again, when we look at our culture, I have utmost respect for our beliefs, our religion, our culture. I do believe in all this. But there is need to have these conversations in a relationship or in a community as we're having these concerns, because when you look at the matrix or the relationship between the male and the woman, the male is often supposed to be that person who is just looked up to, and the woman is requested to be submissive. So these conversations often don't happen. So the answer to this, and what we usually do, Dr. Mujajati, is create that link of communication. And this is the best way to figure out if you're actually sexually incompatible with perpetual problems that can be negotiated right now. And if they come up later on, you can still work through them. Or are they unsolvable problems? Because when you're communicating throughout the relationship, before, during, and after sex, then you're actually, trying to find out all these concerns, because it's not just an important thing for sexual compatibility, but it's also an important component of consent as well. And I bring this up because this is something that also comes about oftentimes, that, especially in marriages where, again, many of the viewers may not be, again, we are going to be candid. Of many women feel that, they're actually having told to have sex when, they have not consented. Yes, they're married, but there's also that element of, marital consent and having sex there as well. So again, to answer, how do we deal with this? It's a long journey of communicating. You go through every literal conversation about sex, what sex means to both partners, where is the halfway meeting, what can you compromise, what can you negotiate on, and how can we work through this? And once we find that, we actually help them. And we also guide them, as I am helping our viewers understand today, to understand whether this is a perpetual problem, whether this is something that can be negotiated and compromised now, versus whether this is most likely an unsolvable problem. Like, this is something where you are not looking through it at the same level, and you really need to choose right now whether you are really compatible or not. But the answer is an honest and clear conversation with your partner on what sex means to you and what desires means to you.
I'm glad you've ended the comment on the issue of what desire means. So let's go into this issue of desire disorders. But before we go any further, I need you to first of all tell us, where do desires come from? Needs and desires. Where do they sit in our brains? Where do they come from?
Okay, so Dr. Mujadati, our brain has many different parts, and from medical school, we do know that there's more from the neck going up than there is down. Because the brain is such a sensitive organ, it has many different parts that is responsible for the desire. So one part of the brain that is responsible for libido and arousal and the pleasure center, we call it the amygdala. And also the part that is controlling your executive feelings and your behaviors is the frontal lobe, which helps you focus on whether you're excited about this or not. Now, what is it that causes, and where do needs and desires come from? We grow up in an environment. So the first thing is understanding the environment, because the environment is what helps us understand and where our desires come from. Things like where you like to have sex, whether the lights are on or off. And I'm talking about basic things, if and what music is playing, and room temperature, all factor into your preferred sexual atmosphere. And all of these have to do with your environment. And then the second part is the desire also comes in understanding how long you want to have the sex for, and how frequent you want to have sex for, and also understanding the concept of libido. Because, Dr. Mujajati, one thing about libido is that, yes, we all have inherent inbuilt libido systems in our body, but the libido actually waxes and wanes. What I mean by that, there are times when your libido is high, and there are times when you feel like your libido is low. And again, the cause and the desires come from your surrounding stressors. If you have stressors, then libido often goes down. It could be financial, it could be environmental, socioeconomic issues as well. Then in women, things like pregnancy and having children early on, in terms of younger children under 5, also brings down the libido at times. Okay, for men and women together, work, health, environmental changes, and certain physical conditions also have an impact on your desire to have sex or not. For men in our country and women as well, we have a burden of diabetes and hypertension as well. And this has a direct impact on your sex life as well. So these are things that we need to understand. Another thing, Dr. Mujajati, is underlying mental health conditions and disorders, which I hope we can discuss in the later conversation, such as major depressive disorder, anxiety disorder, attention deficit hyperactivity disorder. These are conditions that many of us in Zambia don't know, but these also lead to desires of excessive sex or reduced sex. And then earlier on, Dr. Mujajati, I did mention that there is what we call the sexual response cycle, which guides the desires of us. And the sexual response cycle is basically a sequence of physical and emotional changes that occur as a person becomes sexually aroused and participates in a sexually stimulating activity. So again,
Mm.
Dr. Mujayati, in this, there are 4 stages that people need to be aware of that lead to it. The first part is your libido, which is your desire itself. The second stage is your arousal, your excitement. The third stage is your orgasm, where you get that euphoria of the climax of the sexual activity. And finally, there's the resolution, where after the climax, your body comes back to its normal self. So all of these things are very important to understand in terms of desire as well, because if a person is going through all 4 stages, then they feel satisfied and they feel like, okay, I'm having a healthy sexual life. And if a person doesn't have that, then the desire for having sex is usually not there as well. So there are many reasons why a person would have sexual desires or not. Other things, right now we are commemorating the 16 days against gender-based violence. So again, we talk about things like, gender-based interpersonal violence and sex, as well as rape and molestation. If individuals have that history as well, that has a direct impact on your sexual desire as well. In women, oftentimes, and now also in men, also body awareness, your own self-esteem and your own confidence about how you look or how you appear, and how the opposite sex or the sex that you're attracted to looks at you. That also promotes your sexual desire. So there are many, causes and environmental factors that promote sexual desires, and all of these are well known to you as an individual because you need to be self-aware.
So, having said that, doctor, is there such a thing as too much or too little sexual desire?
Dr. Mujajati, for that one, there's a yes and no. A yes in the sense that if it's a sexual disorder where you're having excessive sex and it's having an impact on your day-to-day functioning, you're not able to go to work or you're not able to focus on your responsibilities or school, then yes, that is an issue. That's too much there, right there. But then on the other hand, in terms of sexual frequency, how many times can you have sex in a day with your partner? There's no right answer to that. If you have the energy, if you have the stamina, and both of you are happy about it, then there's no limit to it, because this is what we know in health and well-being, to say there's really no limit per se. But again, as I said, you have to also look at your functionality. How often are you having sex? Again, Dr. Mujajati, a caution to our viewers, because this is something that we are seeing in our system as well here in Zambia, using enhancers to get that stamina to have sex, especially for the men, is something that needs to be of concern. If you're actually using influencers and substances to get that stamina, then that's actually not okay. That's not normal, because you're actually using something outside from your body to get you and your brain to function, to get that part of your body to be activated, and also get your private part or your anatomical parts to actually function. So that again is a problem. So if you're using substances to increase your stamina or your frequency, then again that is not a problem. But to answer your question, Dr. Mujajati, there's no limit to how often you can actually have sex.
Mm. Now, Doc, let's talk about this issue of sex addiction. And I think this lingers, it meets sort of it's still in the same area of sexual desire disorders. So let's talk about addiction. Is sex addiction a real thing?
So for this one, Dr. Mujajati, we talk about it in mental health as a form of compulsive sexual disorder. What do I mean by compulsive sexual disorder? Where you are constantly in the need, you're constantly in the need to have that desire to have sex and go through those cycles of that I just mentioned, of arousal, orgasm, and then resolution. So to answer your question, yes, there is sex addiction, but that is a lay term. It is not identified as a diagnosis. A diagnosis rather is what we call compulsive sexual disorder, and this is what we call hypersexuality. And this is where it is an excessive preoccupation where you're constantly just thinking about it with sexual fantasies, or you have sexual urges, or you actually carry out sexual behaviors that are difficult to control. The key word being difficult to control. You don't have control over them. And it leads to distress. You feel uneasy, you don't feel like your usual self, or it negatively affects your health. And not just your physical health, but also your job, your relationships, interpersonal relationships. If you're married or if you're in a relationship, it affects that, or with your children as well, or other parts of your life. And it usually involves it takes away. So Dr. Mujahideen, one of the things in mental health and psychiatry with respect to sex and having a healthy sexual life with desires is understanding that you need to enjoy your sexual experiences. This is something that people need to understand. You need to enjoy your sexual experiences. And if an individual is actually carrying out an act of a sexual practice and they're not enjoying it, then that is actually a problem, because it's not really giving you that desire, that arousal, and that orgasm, and that is not healthy. So again, to answer, um, it's more of an imbalance of the natural brain chemicals that leads to hypersexuality. There are changes in the brain pathway, and then there's also certain conditions that can lead to that. And again, what are the symptoms, or what are the complications that come with sexual addiction, or rather hypersexuality? It's where the sexual behavior can have many negative consequences that affect both the individual that is having that hypersexuality and others. They have struggles with self-esteem. They struggle with feelings of guilt, especially in a culture like ours with religion and cultural understanding. They have shame and low self-esteem. They develop other mental health conditions such as clinical depression. Others think of self-harming or suicidal thoughts. They have severe distress and anxiety. Um, I actually had a situation where one of the clients that came through had total loss of focus to engage in, sexual relationships outside. Literally, that person was just so involved in the sexual acts that the person didn't want to do anything. No job, no education, nothing. Just focusing on having sex. And then there's also neglect on other issues, and this may also complicate where things like sexually transmitted diseases, and they also sometimes go into using influencers. When I say influencers, these are things that they use to keep on having that stamina and energy to keep going. Take certain medication, over-the-counter medication, or herbal medication, or visit a traditional doctor to get something so that they can keep going. But again, when you ask these individuals, a person that is living with hypersexuality, that are you enjoying, they will tell you that no, I do not enjoy having the sex, but I constantly have this urge to keep having that sex. So this is what we mean to say, we do have hypersexuality, which is also known as addiction, but that is not a statistical diagnosis. But hypersexuality or compulsive sexual disorder is a concern, and it is present in our setting here in Zambia. And also, these individuals also sometimes, because of their risky habits, end up in problems with the law, because sometimes we actually get these cases that come through from the police or the law enforcement.
Doctor, let's talk about self-pleasure. And here we are discussing the issue of masturbation. Um, is masturbation a disorder?
So, Dr. Mujayati, for this one, no. Masturbation, from the health perspective, as a medical doctor, as a scientist, it's not a problem. But from the religious perspective, from the cultural perspective, it is not okay. And I say this because health, Dr. Mujayati, is defined as a complete state of physical, mental, and social well-being. And under social is where the community and the religious and the cultural aspect comes in. And this is what makes us as a whole. So there's a two-way answer. From just the physical part of it, masturbation is completely normal. And according to sex therapists as well as sex specialists, I am not a sex specialist, but according to sex specialists, it is a way to get to know your body. And it's according to health, as a doctor, it's a healthy and a normal thing to do. But then there are tons of myths that actually surround masturbation because of, a very strong pillar of our well-being is religion and culture. So to come back to your point, it is normal to masturbate, and how normal or how often you have to do it. Um, you know, once a week, every other day, it depends how much stamina you have, how much energy you have. And it's normal to do it daily and sometimes more. And I'm saying this from the health perspective, but from the religious perspective, no. It's a problem when it makes you, for instance, late for something, or again, coming back to your functionality, again, coming back to your pleasure. If you're masturbating and you're not getting the desire out of it, if you're not getting the pleasure out of it, then again, Dr. Mujajati, that is a problem. That is not normal. Okay? So, in a nutshell, it is not a disorder at all. But because of the cultural connotations that come with it and the religious element that comes with it, it is not allowed. Because even in our religion, we say it's not allowed. And that's the truth to that part of it.
Yeah, because even in the Christian religion, masturbation is actually not encouraged. It's actually frowned upon. But like you rightly said, from the medical standpoint, it is not a disorder, and there are no health problems that come because of masturbation. And mostly the problems will arise because of your religious persuasions. Thanks, doctor, for that. Let's talk about pornography.
Okay, so
And
pornography.
we've also seen a lot of sex tapes on social media, a lot of exhibitionist sort of behavior.
Mhm.
When when does pornography become a problem, or is pornography a problem with regards to sexual disorders?
So pornography, Dr. Mujajati, is not a diagnosable condition or disorder in psychiatry or mental health. But Dr. Mujajati, it's one of the common presentations that I do see in practice, and also amongst the youth and adolescents as well. It is something that is very common in our country here in Zambia. And as you've rightfully shared, to say, look, we have all these social media platforms where there is access to pornography. Now, although pornography use is certainly common in our practice as well as from social media, it is worth understanding that the mental health effects of pornography are still being studied. Uh, the truth, Dr. Mujajati, is that the information around pornography is inconclusive. And the answer is similar to masturbation, where from the health perspective, um, pornography is still being understood. But from the religious and cultural perspective, it's a no, it's a sin. But then at the same time, I would like to mention that from my practice and also studies, it's shown that many people actually get access to pornography as early as ages of 10 to 12. And that's still the age where the brain is still developing, Dr. Mujajati, especially the part of the brain which decides what is right and what is wrong, the frontal lobe. And then by the time a person is 16 to 18, majority, 99% of adult men have actually, and women have actually said that, they have actually indulged in pornography. So that is clearly a problem. And Dr. Mujajati, further, in the past 2 years during the COVID pandemic, it has been found, according to studies, that there has been a surge of traffic in individuals visiting and frequenting websites that showcase pornography. And again, the truth of the matter is these sites and these industry, the pornography industry, actually knows that it is a business model that runs on pleasure and neuroscientific evidence, such that it is a behavioral addiction. It's such that once you start using it, there is a surge in the parts of the brain that leads to pleasure, that leads to increase in wanting that over and over again. So coming to your answer, um, people that actually indulge in pornography, according to some studies, it has shown that people that actually indulge in pornography have a distorted or disturbed self-body image. They have an altered body image where, because what they watch on the pornography viewing and what they see in themselves or in their reality, they don't feel like, it's the same. So people that consume pornography often have a distorted or a disturbed self-esteem. Another thing, Dr. Mujajati, from studies has been shown that for individuals that actually do frequently watch porn, they actually have a reduced sexual satisfaction. So those 4 stages that are guided on the desire of libido, it actually goes down. And there is among those, there's like a negative effect where there's a decrease in that sexual satisfaction. And it actually lowers the threshold for users to actually view sex as a positive thing. So that's something to be of concern. And then, other than that, Dr. Mujajati, what's in my practice, what I have also learned, and I did find some studies that also speak to this, is that individuals that actually take part in pornography often fantasize about other sexual behaviors, because pornography exposes individuals to more attitudes towards sexual encounters and casual sex, and it just brings about this whole new reality that people want to get access to, and bring about needs to want to try something that they've watched. So that's that. And also, studies have shown that individuals that actually partake in pornography have more sexual aggression in real life. So users of pornography are more likely to participate in forms of things like aggression during their own sexual encounters. It's not fully understood how that works, but that has been shown because of the scenarios there. And then, Dr. Mujajati, there's now studies in the past few years that have shown, but not conclusive yet, but this is just out there, that pornography, individuals that start watching porn early on and continue watching it, eventually have a disruption in the frontal lobe, which is a part of the brain that is responsible for executive functioning, taking part in decision making and behaviors. So that is something to understand. So pornography addiction is a behavioral addiction, which is not in the statistical diagnosis, but it is a problem that we do encounter right here in Zambia as well. And I have had not just individuals come through, but also parents bring their young youth and adolescents through with this concern today as well. And also, one of the reasons why there is actual sexual incompatibility amongst couples today because of viewing of pornography.
Right. So you are saying that pornography should be discouraged. That's what you're saying.
Yes, I believe that, sometimes, and to be honest, things like culture, religion, to an extent, actually act as protective factors. Because when you look at the alarming rate of concerns that comes about due to pornography and the impact that it's having on individuals' lives and well-being, there is a lot of harm that is being done. And because of that, from a health perspective, pornography actually affects the wiring of your brain as well. And we are yet to conclude on that with studies, but it is showing that it causes more harm than good.
Right. So, doctor, let's talk about issues to do with, I know this is a medical term, but I know you can break it down. Let's talk about paraphilias. These are people who are aroused, sexually aroused, by things that are a bit strange. So, could you just define what paraphilia is and give us examples?
Okay, so Dr. Mujajati, paraphilias, para, other, philias, love for other things. Okay, so it's a Latin term. Para means other, alternative, and philia basically means love. According to mental health and psychiatry, society is what deems what is right and what is wrong, what is normal and what is abnormal. And this is where paraphilia comes in. And as you rightfully put it, this is where there is persistent and recurrent. So it's persistent meaning that this person continually thinks in that manner, and recurrent meaning that continue. It's like continuous. They have these persistent sexual interests, urges, and fantasies, or even behaviors of marked intensely involving objects, activities, or even situations that are atypical in nature, which are not normal according to societal norms and cultural norms and religious norms. So it's not really pathological per se, Dr. Mujajati. And when I say pathological, I mean disorder per se, but it actually is something that invokes harm, distress, or again, as I alluded to earlier, functional impairment in the lives of the individuals themselves. And examples include things like pedophilia, right? And this is the very first one that I speak of because this is something that we have seen in our practice, and this usually come through due to the law. They are usually apprehended by the law. So pedophilia is basically where someone has an affiliation towards children pre-puberty. They haven't yet reached puberty, and they have an affiliation towards that. Then we also have fetish disorders, where individuals have a sexual attraction towards inanimate objects, things that are not alive. Okay, so they have that attraction towards that. Then we also have exhibitionist disorder. This is where an individual gets sexually aroused by exposing their own private parts to an unwilling stranger. So this is just the urge where an individual just wants to, show their private parts or genitalia to an unwilling stranger, and they get aroused by that. Then we also actually have what we call a disorder where an individual gets sexually aroused by touching an unsuspected person, where a person is just wants to have sex with someone they totally don't know, and they just want to touch them and want to get the desire out of that. But then coming to us here, paraphilias, Dr. Mujajati, I would like to also guide and share on these two, which we call sexual sadism disorder as well as sexual masochism disorder. Now, what are these two? There's sadism and there's masochism. Now, for sexual sadism disorder, this is where a person gets sexually aroused by inflicting pain on another person. So this person will go through the sexual response and arousal, and the desire will come through when they inflict pain on another person. And then on the other hand, sexual masochism disorder is where a person will only get aroused when they are receiving the pain. So once that person is getting some form of pain, they actually get sexually aroused. So these are different types of paraphilias. And I speak of the last two, which is sexual sadism and masochism, because there is an element of patriarchy there. There is an element of gender-based violence and interpersonal violence there as well, because we see a lot of concerns that come through where individuals say that the person is hurting me every time we're having sexual intercourse, and you're trying to get to the bottom of it, and you find out from the person to say the person enjoys or gets aroused just when they inflict pain on another person, and vice versa. There are a few individuals that will say, I only feel sexually aroused when I am being, I am on the receiving end of the pain. So this is what we actually call paraphilias, and these are actual sexual disorders that are diagnosed in mental health and psychiatry.
And there are those people who are found having sexual intercourse with animals.
Yes, so that is now under the form of bestiality, and that is also paraphilia, but that is more as I guided bestiality, where an individual has an affiliation towards another animal, or basically not a human species, but outside that.
Right. Doctor, if you will allow, we can take maybe 10 minutes to answer questions from our listeners before we close. So let's see if we have a few questions. We'll just take 10 minutes to answer questions and close. I know you've unpacked a lot of information, and I know that probably this topic we might need to come back and deal with the questions probably later on. But yeah, let's see if we have questions. All right. I'm happy that we don't have questions, because I was afraid that we may have too many. Okay, there's one here, which is related to sadism. Doctor, you can see that question? Is sadism related to any form of sexual abuse?
So yes, to an extent it is, because this is why we categorize them under sexual disorders in paraphilia. If an individual is inflicting pain on another person, that person who is getting that pain, if that person is not happy about it, if that person is not comfortable with it, then clearly that is a problem. And this is where we also talk about sexual compatibility. If a couple is not happy, if any individual in a couple is not happy about a particular sexual practice, then that is actually a problem.
All right, there's a question here. Doctor, where can a sex addict receive treatment?
Okay, so as I guided earlier on, Dr. Mujajati, I am not a sex specialist, but because of my line of work, I do interact and have to, support individuals that have these concerns. Individuals can actually get support for sexual concerns or sexual disorders at any healthcare hospital, really, or clinic, and they really need to communicate that and ask to see a mental health professional in that setting. So, for instance, at tertiary hospitals, there are mental health units where an individual can request to be referred to, and then from there they can start that conversation. Other than that, we do have some psychosocial counselors, but they're not there in the private, who actually support with sex, and they're actually known as sex therapists. But here in Zambia, any healthcare hospital where there is a mental health unit, you can go there and you can request for support with sexual concerns.
Muleya Bumba is asking, Doctor, is smacking or hitting the body related to sexual sadism? I don't know what it means. Do you understand the question, Doc?
Yes, I do, Dr. Mujajati. So it's basically asking.
All right, I don't know what he means, but go ahead.
So it's basically when having sexual intercourse, when a person hits the behind of their partner, is that sadism? If the partner doesn't have an issue or doesn't have a concern, then that's not sexual sadism. But if it is indeed something that you are doing as an individual and you're enjoying it, inflicting with the thought that you're inflicting pain in another person, then yes, that is a sexual sadism. But otherwise, it is not.
Right. Okay. Doctor, looks like we have a lot of questions. Yeah. Doc, we're not going to get out of here. We should just come back and do a part 2 where we just answer questions, to be fair. Because the questions are too many, Doc. We end up sleeping here.
I think so, yes.
Can we agree? Can we agree that you can come back so that you can just come and tackle these questions, because there are so many?
Yes, and some of these questions, Dr. Mujadati, I'm reading, for instance, is masturbation good for your health? Most of them have actually been answered.
Yeah,
So
yeah.
I would actually request a few people to rewatch this and just get an understanding. And then after that, yes, I can always come through and we can discuss this topic further. And also, as we discuss, we can have more discussions around mental health and well-being awareness and mental disorders in the country.
Right. I'm so happy that you've agreed to come back. And also, I'm so happy you've mentioned that there are a number of mental health topics we need to go through. And it's good that you're available for us to do that. And let's, people, go ahead, keep putting your questions in, keep throwing your questions. We will make time where the doctor will come back just to answer these questions, because we don't want to leave out some questions and then, yeah. So what we'll do is that myself and my team will organize these questions properly and then let the doctor come and deal with them. Now, Doc, you know that Zambia is a very closed society. Issues related to sex are very difficult to discuss. Sexual disorders are extremely difficult to discuss. There's one issue here that we haven't touched on, and I'm hoping that we can touch on it next time. This has to do with the question of whether same-sex people, whether it's a medical condition or not. We didn't have time to touch that, but then I'm sure in future we might. But then, how then do we get to a point where, as a society, we are able to discuss matters in a healthy way or in a manner that actually promotes health?
Uh, Dr. Mujahati, for this one, one of the things that I note is that we have
Dr.
a
Dalal,
shift.
are you still here?
Yes, I am. Can you hear me, Dr. Mujahati?
I can hear you. Did you get my last question?
Yes, I did. So the answer to that is, in a manner that is sensitive to all, we need to have such platforms and such fora where we discuss these things in a way that is promoting awareness and information. For instance, literacy, rather than stigmatizing, discriminating, or finger pointing at individuals that may be facing these problems. So I have come through here, and you have invited me here, and we have been here candid in our professional capacity, and we recognize that the reality is out there, and there are many people that we love, that we care for, and citizens amongst us who are engaging in these habits and behaviors that may be risky for them. And we need to have more opportunities to have these discussions openly. Of course, not forgetting and respecting our religious views, our cultural views as well. I believe there's room for all of this today, especially with the current generations that are coming up that are more open to have these conversations. So keep doing what you're doing, Dr. Mujajati. You're doing an amazing job. Thank you for this opportunity, because we need to have these conversations. Again, I may not believe in most of the things that we've discussed, but I do know that because of the education and the professionalism that I have, we should be able to have these conversations in a way where we are promoting respect and support for everyone.
Right. Doctor, thank you so much for coming through, and do have a great night. And like you've seen, we do have a lot of questions that we would have to come and answer next time. So thanks for coming, Doc, and thanks for making time for us. And on behalf of the Water Tribe, we also saw you drinking water. It's good to see that you're a member of the Water Tribe.
Yes, thank you so much, Dr. Mujahati. Sikomo Kwambili, have a good night. And to the Water Tribe, take care of yourself and continue drinking water.
Right. Take care, Doc. Good night.
Good night.
So, right, there you have it, ladies and gentlemen. Please go ahead and click that share button. We need this information out as much as possible. And like we keep saying, maintain the decorum of the page, because I've seen that some people have gotten a bit excited and they've, forgotten that, there's decorum on this page. We don't want to start blocking anyone for misbehaving. We are all adults here. This is a very serious platform. Please maintain the decorum of the page. That said, ladies and gentlemen, click that share button. Let's spread as much of this knowledge as we can. And for us as a page, we will bring as much information to you as we can so that everybody is educated and everybody is well informed. That said, ladies and gentlemen, from me